I spoke to the media at the end of September. It was only 37 hospitals. I think it was on by the 30th of September. There's been continuous engagement during the course of October and November. That number is currently standing at 77. Engagement on a regular basis with ESCOM, but also with municipalities. Some of the areas, they indicate that there's work which is being quantified. Some of it has already been done, and we're looking at then how to mitigate against situations where there's users in the local community, whether it may be factories, residential areas, and so on. But there are some steps which are being taken. In the coming week, the DG and the team will also be meeting not only with ESCOM, but also with the COCTA and SALGA, because we need to be able to secure the lines for supply of electricity to our hospitals. That's really in the medium. We are not happy with just 77 hospitals out of the figure is over, the prioritized health facilities are over 200, I think, just slowly, but our colleagues here have urged that we must really double our efforts as the load shedding, it clearly is going to be something we're going to live with for a very long time. In the medium to long term, of course, there is some work being done with the council of the kind of equipment which we can then use to have secure supply of alternative energy, especially the solar power, because we needed some work to be done. So that is being planned for the beginning of the. We are also approaching Treasury, because many of our colleagues here can confirm that because of this load shedding, our generators, each hospital has a generator, but they are not meant to run 24 hours, 36 hours, 48 hours in terms of the. Those are some of the things which we are also approaching colleagues in the Treasury. Let me stop there, the facilitator, and we can take some questions from the colleagues from the media. Thank you.
Thank you, Minister. We will quickly then determine whether we need to go to the second round, but I think 7 might do as the first and the last round. Yes, you indicate which media house you come from. Yes.
Okay.
Good morning. My understanding from your presentation is that there's still a low uptake in terms of the vaccine, but you're also seeing high levels of immunity. So what has informed the immunity? In terms of load shedding, if I heard you just before you closed off your speech, you said that the budgets for oils and fuel are exempted from load shedding and others are not. So the majority, and also said the figures around 240 hospitals that are supposed to be priority. With the exhausted budgets, what does that mean? And lastly, on measles, do you foresee the cases of measles to increase over this particular phase?
It's the Nico Mhlaba from Newsroom Africa. On the issue of load shedding in hospitals, I just want to get a sense, does the department feel that enough is being done to solve the energy crisis in South Africa from the health perspective? Do you see any progress in terms of solving that from your perspective as the health perspective? Thank you.
Hi, Jaka from ENCA. I'm basically here for load shedding because I just want to understand, like, so how are hospitals going to cope with that? And then I have a question for, I'm sure the NEC for Health in Limpopo might be best to answer this, but I know that 21 emergency care officers were deregistered, and now we're moving into the festive season where obviously there's a lot of activities going on. How is the province going to handle that? And actually just generally in the country, do we have enough paramedics, and is there enough security to protect them, because we know that they're often attacked when they're out on call. But load shedding is number one. Okay.
Pastor from Tehran, I said, just in terms of the budget that's been going through at the hospital during load shedding, are you able to explain how much of that it is? In terms of the diesel, etc. So maybe we could just get a figure of how much it is.
Okay, we seem like
We're done.
yeah.
Okay.
Respond.
Well, thank you very much. I'm happy that there's a question also. I wished that more MECs were asked the questions so that they would. Okay, I'm sure they can. From Heidi, I'm sure MEC for Gauteng might have something to say about the load shedding. From Duma on the low uptake of vaccine. Well, this is not a unique South African experience. Whether you talk to colleagues, I mean, now that we are not only, was it August, where we had whole Africa, region, but also at various forums, SADC, you have the same experience that the appetite for vaccination, people feel that the COVID is no more such a threat and so on, then there's quite a lot of complacency. But your question was also, despite that, we are seeing quite a high level of immunity, and we believe the reason for that, one, as we have said, the fact that we focus who will, even when you look at the earlier COVID when there was no vaccination, the major fatalities of people who were losing their lives were that age group above, and the older people are, the more at risk. The fact that that population is vaccinated more than 70% has really helped, but we would still encourage them to go for boosters. Those who have not had boosters, to go for boosters. We still have sufficient numbers of vaccines, both that the fact that the Omicron spread quickly amongst even younger people and older people, it created also a natural immunity. But while it is a safeguard of some sort, it's your natural antibodies and T cells and all those, if they are not boosted by something else which trigger them to be active, you're going to run out of them. So it's still helping, but provided nothing similar comes back, so we still wish to advise, even those vaccinated, it will be safer. The load shedding, maybe we can deal with this together with Sibatle's question. Indeed, each facility, first of all, there is security, all various, what we call the non-negotiable key deliverables, which keeps a hospital functional. And obviously, we don't regard provision of electricity fails, and that you expect the tripping of the main, what do they call, the transformer, which takes a few hours and so on. So when it happens like this, that allocated budget, gets exhausted because of, the actual figure will be difficult to quantify here and now. I know we do have one of our chief directors who, works very closely with each one of the hospitals. He has already just during the course of this calendar year visited. Thing is that in terms of the normal budgeting, that in most of the hospitals has been exhausted because it wasn't anticipated. And maybe let me deal directly also with Heidi's question about we hope more can be done, by the technical people who run the power stations, by the management at ESCOM, by within our colleagues who being done when we don't experience load shedding. As long as not only is it remaining with us, but as long as it's rising, I know that on a daily basis they would explain this power station has tripped, this service, and as a result we are unable to provide secure services. So we're urging them to identify those key areas which keep, letting us down, that they must get deep into the nitty-gritty of what are these things which trying to explain that, but all that we are interested in is, can we get the electricity so that in this case, as people who must look after the health of the people can get it. So we're definitely very unhappy. We would want to encourage them to do more so that we don't get this power. Whether the measles will increase over the festive season, that's what we want to prevent, because we know that an infectious disease like measles, when there is more contact, because it's spread through contact between people. And as the children especially get and come back, there is the risk. So that's why we are agreeing that over the next week we need to use all opportunities available to make sure that we can up our vaccination and provide more stock and more personnel to do that. I'll leave the issue of the because the fact that we need to train more paramedics. We do have, there are some, the gentleman who was reporting here, our head of emergency services in the National Department, who's working with all provinces, did give us also an update in terms of the fact that we are not training enough. Also the competency. In the past, you could do what is called the basic ambulance assistant. We no more recognize that. You need to be upgraded to have a much more better skills. So all that needs to be done across the country. So Ramatuba will deal with that. Thank you.
Minister, do you mind if she takes a seat now?
She can, yeah, she can.
I'll give her the seat. She's come.
No, she can.
Morning, Minister, once more, and morning, colleagues from the media. I think what we need to firstly clarify is that the health professional reasons which are known to the HPCSA and the professional involved. Some of the reasons from our findings will be a professional has defaulted in terms of annual registration. It is our responsibility as individual health professionals to make sure that your license to practice is up to date. As such, you are prohibited to touch the patient if your license is not up to date. It's a simple thing like when your accident is insured, your insurance will not pay because you don't have a driver's license, which is a requirement for you to be able to drive. So with the current employees, unfortunately, once that is done, it means in our sector, it's the Pharmacy Council, it's the Nursing Council, and the Health Professional Council. And all these statutory bodies are there to regulate the professionals. So what your question is, now that we are facing the festive season, what is currently going to happen? Of course, when you lose 21 employees, it will definitely have impact on service delivery. But at the same time, we still have got margin if we allow them to practice illegally. You get involved in an accident. When you get involved in an accident, we classify you either priority 1 patient, priority 2, 3, and anything can happen. A priority 1 patient can convert to priority 4. Priority 4 is those ones who have passed on. If you are touched or a mistake, but because nature, it was your time, your family comes back and say, Dr. Ramatuba is not registered with the council and was allowed to touch, and my family has died. We are sitting with a litigation bill of how much? Contingency liability. And allowing people who are not registered with the council, you will be charging me to say, as an executive authority, why did I allow our contract with healthcare professionals? It's informed by that license. Once there is no license, it becomes difficult. I know your next question, Minister, will be why don't you shift them to work as cleaners or porters or something? The question that there is, because that's what one of the journalists asked me, the answer would be simple. If I'm appointed as a medical doctor, the question that the Auditor General we were discussing AG report, I'll be found wanting. How did you appoint this person to be a clean? Did you follow all the prescripts? So that's why it's very difficult. We're looking for EMS personnel, and they must have the license to practice. We have advised them to go and sort out their matter with the Health Professional Council, because even the advert is very clear. And
Thank you very much. Thank you, colleagues. We still have some work to do. I'm sure you also still have some work to do, but thank you very much. We hope the message to the country will be clear. I see Duma wants one last bite. You also, Heidi, wants one last bite. Doctor? Okay, all right. We still have some work, but let's allow the two.
Just for clarity, because you're with healthcare professionals here,
Don't know how to do a good job.
on the forecasting, what is it that you are anticipating? And just also on that response, during the festive season, what message do you have for parents? Because I know that this is a disease that particularly affecting children. You know, you're going to be playing in ponds and rivers and various.
Because she seemed to be more interested in the, very, very progressive. She wants other colleagues to also take some of the questions. As I said, you know, we have tried and tested extended program on immunization, which has been working. If you look, there will be exceptional years where we'll get this, you know, outbreaks. This is quite worrying, but up to this stage, you know, as much as there's been significant numbers in Limpopo, in Mpumalanga, and now a number of cases in Northwest and Gauteng, we believe that we have the capacity to can contain. But because of the fact that we know there's going to be too much movement, and I want to combine with your latter question, what we, in terms of vaccination, not just the COVID, but also tried and tested vaccination, especially for children. Various diseases have been eliminated because of these vaccination programs. So we're confident that if we can get good cooperation from society, from parents especially, has ever been immunized, please visit your nearest health facility so that you know, they can be able to be, if in doubt, we would rather give a dose or 2 doses of measles vaccine if we are in doubt. So we are not, if we can get this message, we're going to, all of us, use all other media platforms to encourage parents to get their children's road to health charts be checked so that they can verify that they do have the measles vaccine. If not, if they've got, and those who are traveling. If by some mistake you didn't check and you realize you're already on the road, we might not be on every small road, but the big roads which is carrying huge volumes, please look out, please check there because you might just be able to get an assistance in that regard. Let's get to Heidi. I hope she's got the mic.
No, that's okay. So at a stage where you need to ask National Treasury for more money to fuel your generators. Secondly, I know the question was answered yesterday by the MEC of Health for Gauteng, but I would like as well as Anglo-Goldshanti Hospital.
Well, you say that the MEC did answer
But you
them.
as the minister, I would like to respond.
Well, no, the answer is that when that report they've received, they will look at it and they will make it available to us at the national government because we are an interested party. So that's definitely the next step, not only at Tembisa but in Gauteng, but elsewhere in the country.
National Treasury?
Well, yes, we are at the stage where the cost of fuel and oil and maintenance of generators, it's not what has been expected in the 2022-23 financial year. The colleague and his team are coordinating with the national CFOs, with all the provincial CFOs to put a figure, which we will make a case. I know that the medium-term budget, what do they call, there's some term unforeseen and unpredictable, whatever category. We hope that we will still be considered in that regard, but it's definitely a burning issue. Can we be allowed with your friends to carry on?
Thank you, colleagues. And we leave Minister and team else.
Go for lunch, colleagues. 30 minutes. We'll try and reprioritize so that I know that you've got other pressures. If we can just have 30 minutes, I hope the bookkeeper.
3 o'clock, we are back.
I think it's
10 past 3.
yeah, 10 past 3 if we can be back. We'll take about 1.5 hours at the most if we can come back at 10 past.
Prime Minister, we bambega at the thanks.
Aish.
Yeah.
But they want us to condemn our other colleagues. But it's a fact.
Yabuwa.
Ngoma nje la.
Zathi baleke le information abafundi bezalo.
Ipale phansi uyibhala ngani?
Yebo phaya.
Oh.
Lo remember ngifike ngisithe efonini.
Hayi kanti kubalekile. It's very very important.
Vale ithatha ngokuthi
Hayi man sesebenze over 20 hours. No. Hayi. Awusinganyana ngo5 kuze kushaya u5 futhi. Hayi.
Hello?
5 to 5 konke njalo.
Okay, sure. Okay.
Asambeni, qedwe sambeni. Yabona. Ayibona into engisho. Ngazi ngifuna ukutshela imbalisa ngaphi le igqole yangu ubone tight. Shoko ngithi ngizomtholela uWhatsApp hayi. Yangu ubone tight akhambi kahle. Leg straight. Either you wear a straight legging or no tight at all. Oh, usho nibed, ikebed. Yeah, fanele. Angisafuna uba la.
Kunini? Uncede nephahla wayikhawulezisa ukuthi nophatha